When you experience pain in your feet or legs, you might immediately think something is going on that's muscle related, but that may not always be the case. Dr. Marc Camacho is here. He's a vascular surgeon with Secours Vein and Vascular Associates, and he has more on what you should know about peripheral arterial disease. Wow, that sounds serious. What are some of the causes and what is it?
Well, there's many different causes that can cause pain in your legs, and one of those things that we worry about is peripheral arterial disease. And the major cause is buildup of plaque or fatty substances that build up inside your arteries that really narrows the artery and does not allow a lot of blood flow to get to your legs, and can then cause muscle cramping and can eventually lead to ulcers or even gangrene or needing to have your leg cut off. If it's really bad.
Oh, wow. Okay, so, but before you, I guess, get to that extreme, you're going to feel some pain when you walk if you're, you know, suffering some symptoms. And, I mean, when we're talking about pain, it's some of the things you described, just in a normal walking pattern?
So everybody has a little bit of difference. You know, a lot of people talk about cramping or pain in their calves or feet when they're walking, and that's going to be a fairly consistent amount of distance. It's going to be a couple of blocks, and then if you rest, the pain goes away, and then it comes back when you walk again, that same amount of distance. Sometimes people just say it's heaviness in their legs. So if you're having discomfort and it's really affecting your life, this is something that you really need to speak with your physician about.
Right, and how do you diagnose PAD? I mean, is it an age-related thing? Can it happen at any time? I mean, how do you know that someone's suffering from this specific disease?
Sure, there's many age ranges. I've seen people in their mid-30s that do have PAD, and I've seen people in their 90s that have PAD. So to diagnose this, it's a simple physical exam that your regular doctor can perform, as well as ultrasounds that are minimal discomfort in order to get.
And you talk about gangrene or even having to possibly amputate if it escalates and becomes worse. So what can people do at home to decrease their risk of getting this?
Well, the major things of reducing your risk are going to be keeping your medical conditions in check. If you do have diabetes, keeping your blood sugar under control. If you're a smoker, stop smoking. That's probably one of the best things that you can do. And of course, exercise is going to be very, very important. Just walking 30 minutes a day is going to really help you as you move around.
And those are probably good tips just in general to stay healthy. If you do come down with this and you are diagnosed with PAD, how do you treat it?
Well, there's many different ways that we can treat it. I usually move for a medical approach at first, and that's going to be aspirin and keeping your medical conditions in check, as well as a walking program, like I was talking about, 30 minutes a day, just kind of pushing yourself, and that's going to help your body get used to the lower blood flow, as well as make new arteries, and that'll be very helpful for you. Of course, there's other procedures that we can do, balloons, stents, minimally invasive surgeries, and then if we really have to, there's more open surgery or big incisions, bypasses, or cleaning the artery out by hand.
Oh, wow. So is this something pretty common that you see a lot of?
It's surprisingly common. It's something that a lot of people have. Many people think that it's just them getting older. It's not. You're not getting older. There are things that can be causing pain, and it's very important to discuss it with your regular doctor or a specialist if you really need to.
Okay, and again, what are some, I guess, just things to look out for that may tell you that something's going on?
The big things are if you're walking and say if you walk to the mailbox and every time you walk to the mailbox you're getting pain in your calves or even in your buttock area, these are signs that are telling you that there's something wrong. Or if it's a heaviness or a tiredness that you're getting in your legs when you're moving around, these are things that we need to know about, and we can help.
All right. Well, if you want to contact Dr. Marc Camacho, Secours Vein and Vascular Associates, you can make an appointment by calling 397-2383 or log on to goodhelpdocs.com. Thanks for being here.
My pleasure. Thank you.